Welcome to the Genius Factory. Enjoy the video.
You start now. Wash your hands and gently clean the area so nothing traps heat. Soak a clean cloth in warm water 40-45 degrees, wring to remove dripping. If using a microwave, heat for 30-60 seconds and check. Test the cloth on your inner wrist to confirm comfort before applying. Once safe, fold the cloth and place it over the site. Press lightly so the heat reaches tissue. Make sure you maintain steady warmth without burning. Continue by timing each application. Use 10-15-minute cycles to allow circulation to improve without overheating the skin. Once done with the first cycle, re-wet and reheat the cloth so it stays moist. Moist heat transfers energy better than dry heat. Make sure to cover with a light towel if needed to retain temperature, and do not press firmly on swollen areas. Gentle, even contact promotes blood flow and reduces stiffness. If treating eyelids or delicate skin, be extra cautious with temperature and pressure. To finish, pat the area dry and check the skin. Some pinkness is normal, but stop if you see blistering, numbness, or increased pain. Once done, record when you applied heat and how long so you can repeat appropriately or report to a clinician. If symptoms persist beyond 48-72 hours or worsen, make sure to contact a healthcare provider. If a burn occurs, cool with room temperature water and seek immediate care.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.